Welcome, everybody. I'm David Lukoff, and I'll be presenting a couple of workshops later today, but my job right now is to introduce our next speaker, Roger Fallot. And many of these presentations today are going to be recorded, and we hope to have them up on the Mental Health and Spirituality website, mhspirit.org, and the URL is in your program. But there's a whole other way in which a conference functions to build community. And today we've been talking a little bit about building a community, and what we are really building, I think, is a kind of learning community. And it's a chance for people to share their best practices, their insights, their research support for what we're doing, and so on. So it's really a pleasure for me, after citing Roger's work in my own articles on spirituality and recovery, in my PowerPoint slides, he appears many times, and so on, to actually get to hear him and to meet him in person. And we also have another person here, Priscilla Ridgway, who is another important researcher in this field, who is also contributing to this development of a learning community. Roger is a clinical psychologist. He holds a position as Director of Research and Evaluation at Community Connections, which is a private, not-for-profit agency in the District of Columbia, which provides a range of human services. If you do a Google search or a search on PubMed on Roger Fallot, you will find a wide range of publications, not only on spirituality and recovery, where he is one of the true pioneers, but also in the area of recovery from trauma. So he has a lot to share with us today, and I hope you'll give him a good welcome. Thank you.
Good morning. Whenever there's not a clock that I can see very closely, I am prone to putting out of my watch here so I can stay close to being on time. It also reminds me of a story that is probably relevant for this group more than for many others. It reminds me of a story about a guy who went to church with his father for the first time. And he was asking his dad about everything that was going on at this church service. And he said, Dad, what's it mean? That man up front, he's going like this. What's that mean? That means we're supposed to sit down, son. And sure enough, everybody sat down. And he said, well, Dad, what's it mean when he goes like this? He says, well, that means we're supposed to stand up, son. And sure enough, everybody stood up. And, well, Dad, what's it mean when he puts his watch up there on the pulpit like that? He said, son, that doesn't mean a thing. That man's going to go on talking as long as he wants to. This is actually a way for me not to go on talking as long as I want to. In fact, when I was sitting here this morning thinking about what I was breathing out, I was breathing out anxiety about the fact that I prepared about an hour and a half material for 45 minutes worth of talking, and want to make sure that I don't go over time. So yesterday was designated Jay Mahler Day by some of you. I wanted to make sure that I got on the Jay Mahler bandwagon, and I want to start with a little story about Jay from the first time I met him. It was about 15 years ago, and we were attending a conference on what was called at the time Hospital and Community Psychiatry. And it was there was a panel of very prominent researchers who were addressing recovery from mental health problems. And at the end of their presentation, Jay got up, and I knew he was going to ask a good question, although I didn't know him at all, because he at the time was wearing a shirt right in the middle of this conference that was extolling the value of case management approaches to working with people. He had a shirt on that said, I am not a case, and I don't need to be managed. But Jay, at this point, was talking about something else, and asked the researchers, said, words to this effect, that We've heard a lot about the biopsychosocial model of mental health today, and that's fine. But for me, the most important part of my own recovery has been the spiritual. Why is it that we don't hear more about spirituality at conferences like this? And you should have seen the look on the faces of the researchers who were sitting up front. They looked at each other, they looked at the floor, they looked at the ceiling, they looked at the walls. Each of them was, I'm sure, hoping that one of the others would take on the answer to this question. At which point one of them finally said, and I respected this person a great deal because he said exactly what was right. He said, we don't talk about it because we don't know much what to say about it. That was 15 years ago. And I'm not sure that in many of these conferences that we're referring to, the answer would be very much different today. There's a parallel version of this story, of course, for faith communities. People with mental health concerns often report about their involvement with religious groups, and they come back and say, why don't we hear more about mental health issues in this setting? When I'm at church or my synagogue or my mosque, why don't we hear about mental health issues here? And I imagine that the faith community responses would not be so dissimilar from those of the researchers I just mentioned. We don't talk about it because we don't know what to make of it. So people who are left dealing with multiple challenges related to mental health or substance abuse or traumatic violence often experience a chasm between these two worlds. I can't bring my spirituality to my counselor. I can't bring my mental health issues or my trauma issues or my substance abuse issues to my faith community. It's hard to be a whole person anywhere. And that is really the challenge we're facing today. How can we help people and ourselves to be whole people? Now, I've been listening to both sides of these stories for quite a while now. Not quite since horse and buggy days, but close to it, it seems at times. And that's why I find this conference to be such an exciting response to these concerns. I'm grateful to be a part of it, and I want to talk with you today about the lives of people in recovery, from mental health concerns, from substance abuse, from trauma, and about some of the research that addresses the relationships between spirituality on one hand and recovery on the other. As most of you know, researchers can be quite diligent about spending a great deal of time defining their terms. In fact, it's one of the first lessons from research in this area is that we need to define what we mean very clearly. So I'm going to start with a brief discussion of what we mean by spirituality and religion. There are many ways to distinguish these two concepts, and I want to be clear how I will be using the terms today. First, both spirituality and religion can refer at the experiential level to experiences that are related to ultimate meaning, purpose, and values. The key term there is ultimate meaning, purpose, and values. Or these experiences may involve a relationship with a transcendent reality, the sacred, the holy. On the other hand, by contrast, religion is more likely to be distinguished from spirituality at the institutional or organizational level. To the extent that a particular set of experiences finds expression in a defined set of beliefs or doctrine, a regularly structured pattern of ritual or practice, and three, a more or less identifiable community of believers or followers, then it meets the definition of an organized religion. Now, I'm not saying two things. I'm not saying that all religions are equally organized. Back when I was in divinity school, in fact, we used to joke about the United Church of Christ, of which I was a member, getting our doctrine updates to us in loose-leaf binders, whereas churches with long standing, like the Roman Catholics, got theirs written in stone. So there may have been those that were more flexible and more and less organized than others in those dimensions, but that. The other thing I'm not saying is that spiritual activities never look organized or institutionalized. In fact, many spiritual groups are more and more organized and more ritualized. To the extent, though, that spiritual groups become more organized and institutionalized in the ways I'm talking about, then they start meeting the social scientific definition of religion. Now, this distinction has taken on more meaning in the research world because some people are more likely to see themselves as spiritual, while others are more likely to see themselves as religious. Some characterize themselves as both spiritual and religious, and some as neither. I heard many people making this distinction yesterday, by the way. As I was walking around listening to folks conversing with each other, I heard somebody say, I'm not really very religious, I'm very spiritual. And another person said, but I'm really into religion. Religion is very meaningful to me. And that's an important distinction, especially because in this realm, many, many more people in the general population describe themselves as both spiritual and religious than do mental health professionals, who are much more likely to define themselves as spiritual but not religious. And that kind of difference is an important distinction that we're going to come back to as we go along. Nearly 30 years ago, I was describing my interest in psychology and religion to one of my clinical psychology supervisors. And he commented on what he took at that long ago point in time to be my fairly promising future as a psychologist, and then looked at me with as if he were going to give me the most dire warning anyone had ever given anybody else, and said, "You've got a great future if you forget about this religious stuff. Because religion is a quagmire." Religion is a quagmire for many people in the mental health professions. For many mental health professions, it's a swamp of confusion and dangerous predicaments. Religious beliefs and activities, according to some theories, are inherently expressions of developmental immaturity. For others, they emphasize ways in which religious doctrines and rituals have parallels to pathology. Even among many mental health professionals who are more positively disposed to religion or spirituality, there is often a reluctance to talk about it in the clinic. When I discuss this resistance with many clinicians, they simply say that religion seems too personal or too private to ask their clients about. When I ask them what they know about their clients' sex lives or their money, by contrast, they know a great deal. Some mental health folks say that talking about spirituality and religion is beyond their expertise or beyond their scope of practice, that it's something that belongs to chaplains or other religious professionals. Yet even if that is so for a particular clinician, isn't it something that warrants more education rather than neglect? Finally, and most poignantly, are the mental health people who say they are unable to talk about spirituality and religion because it is simply too painful for them to take seriously. That is, that they describe themselves as in recovery themselves from the difficulties of a religious involvement that they've had in their own past. This seems to call more for supervision than ignoring the reality of spirituality and religion for their consumer clients. Now, there have also been barriers still from the side of the faith community. I was visiting my family in Ohio several years ago when my father introduced me to one of the local ministers in the small town where I grew up. And thinking this would be a great point of continuity and a conversation starter, my father said to him, "Oh, my son here teaches in a pastoral counseling program." Well, the minister looked at me and he got a very skeptical look on his face and he said, "And just what do you counsel in this program you're talking about? Do you counsel the wisdom of the Lord or the wisdom of the world?" And I thought, I try to draw on both. I was taken aback a little by this. I was actually just there for the pancakes. I had no idea I was going to get thrilled about this. So his question put me off a bit, and my admittedly incomplete attempts to tell him how I tried to draw on both of these worlds, the wisdom of the Bible, the wisdom of God, the wisdom of the Lord and His Word, and the wisdom of the world, were falling on deaf ears. Clearly for him, this was an either-or situation. You either counseled the wisdom of the Lord or the wisdom of the world. You could not possibly draw on both. For other religious people, skepticism is a response to the tendency of some social scientists to reduce religion and spirituality to psychological or social processes. Belonging to a church, according to some psychologists, is really just a guise for social support, for instance. If that's all it is, and it's nothing, and it's only that, then we understand why religion and faith are much richer than any of these psychosocial functions. A related concern is voiced by those in religious communities who say that psychology takes a purely utilitarian view of religion. A great deal of recent research, for instance, has shown that religious involvement is good for your health, both physically and mentally. You can check out the most recent copy of Spirituality and Health for the latest news. In fact, you know, spirituality and well-being has become a hot topic when the publishing world has devoted a glitzy magazine to it, and spirituality and health is a great example of that. So it is certainly encouraging for many of us who have worked in these overlapping arenas to have evidence that religion may be good for us in many ways. It is not surprising that religious believers often respond to this news with the claim that there is much more to their religious life than the equivalent of vitamins and daily affirmations. Even if religion could not be shown to have such health value, even if religion were neutral at best about health, religion nonetheless carries an ultimacy and a sacredness that must be understood on its own terms. And if it's not taken seriously on its own terms, then we are not doing justice to it. Sometimes people just graphically represent the ways in which religion swallows up science. Now, there's an old story about two men who are out in a lifeboat, and they start getting on each other's nerves. And the one guy finally, just fed up with the other guy's comments, says, "If you don't shut up, I'm going to come down there to your end of the boat and drill a hole in it." Quite an image, isn't it? I think often that people in the mental health and faith communities have adopted an us against them sort of approach that's not unlike these two guys out in the lifeboat, where it either feels that mental health folks are right or the faith community folks are right, but neither of them are able to live well with the other. That in this us against them world, whether the we is mental health based or faith based, we act as if they are not quite as worthy as we are. And this leads to an implicit belief that each person is not really a whole individual, with frequent spiritual and religious strivings that go right along with our bio-psycho-social realities. What I'm proposing today is certainly not revolutionary, nor is it rocket science, as they say. It is simply that a third way of understanding this relationship between spirituality and mental health is simply the way to go, because it is so central to many people's lives, both as individuals and in their cultural context. Spirituality must come to have an equally central place in the thinking and services that go on in the mental health arena. Spirituality is central to the self-understanding of many consumers. Spirituality is also central to the recovery experience of many consumers, and therefore, and this is the key here, if we are going to take person-centered and holistic approaches to services seriously, we simply must incorporate more about religious and spiritual realities. Whether the young man's identity is as a devout Christian, or whether the person's car is in God's hands, or whether our sacred T-shirt carries a Lady of Guadalupe, or whether a young woman in her Muslim garb is proudly and publicly wearing it. We know that spirituality is central to the self-understanding of many consumers. We also know that for many cultures, spirituality and religion are core shaping realities. Spirituality and religion provide a community of fundamental shared ways to understand experience. We learn from culture what matters and what doesn't matter, where to look for things that are important and where to look for things that are unimportant, and to foster certain values. If we believe that, if we are going to take cultural competence seriously, then we simply have to pay attention to spirituality and religion. Whether these cultural dimensions are reflected in the New Mexican Holy Healing Site, or in the culture of Vietnamese Catholicism, or in the African American Baptist tradition, or in the more nationalistic culture of the United States as a whole. We have to understand the cultural context of spirituality and religion in order to take it seriously in people's lives. So we're talking today about what mental health consumers say is most relevant for spirituality and religion. gatherings, an alumnus came up to him and said, well, Chaplain, my son's at the college now, but he's such a sophomore. He's always asking these big, big questions. And the chaplain looked at him and said, oh, and when did you stop? Now, clearly my chaplain was a better prophet than he was a fundraiser at this point. But he raised a very, very important point. It is a luxury and not a particularly enviable one to stop asking the big questions, those that address sacred and ultimate realities, good and evil, social justice and power. It is a luxury not often afforded those frequently struggling with marginalizing and stigmatizing difficulties. Traumatic experiences and serious mental health problems make so many of our intuitive certainties uncertain. Things we often take for granted. The safety, the consistency, the meaningfulness of the world. The existence of solutions to our problems, a shared reality that we can perceive and trust our own judgment about. All of these are called into question by these sorts of marginalizing experiences. And in their place arise alternative explanations, that the world is dangerous and unpredictably so, that hopelessness is more realistic than hope, that our own perceptions of reality may be faulty and invalidated by others. So out of these conflicts, questions then abound. How are we to make sense of these contradictions? To what end are we here if we are so frequently confused and disorganized and fearful and depressed? How do we make sense of good and evil when our intentions are so often challenged by others? How do we construct or reconstruct a sense of our own agency and effectiveness? How can we consistently take on life's daily challenges? How do we regain a sense of direction and purpose and meaning? How do we find and sustain hope for our journey of recovery? These big questions call for big answers. And for those of us overeducated types, at least big discussions and long conversations and unending supplies of coffee. And these are the kinds of answers and discussions that are found in faith communities and in spiritualized activities and in religious rituals. These big questions and the search for answers are keys to recovery. Whether the search for recovery takes us to an AIDS quilt or through the trauma of loss and the roadside memorials, these big questions need answers that are often found in spiritual and religious activities and communities. Now, I wanted to put in a brief description of trauma here because it is so central to my understanding of what goes on in the lives of people with diagnosed mental health problems. Violence and trauma increase the risk of being diagnosed with a mental health problem. They increase the risk of being diagnosed with a substance use problem. They increase the risk of homelessness and incarceration. And increasingly, each of those in turn increases the experience of each of the others. People who are homeless are at increased risk for violence and trauma, as are people who are incarcerated. But most importantly, putting trauma in the middle of our experiences does is that it fixes us on a different set of questions. Rather than asking someone, what is your problem, or what is wrong with you, something we would never do as mental health professionals, right? Although every assessment I've ever done has had a problem-centered list at the end of it. But rather than asking, what is your problem or what is wrong with you, if we ask, what has happened to you in your life? And how have you tried to cope with it? How have you tried to deal with what has happened to you? Then we are moving toward a trauma-informed approach to services. People with mental health, substance abuse, and trauma-related problems have taught us mental health professionals a lot about the ways their personal strengths are important in the process of the recovery. Trauma survivors, for instance, not to put too fine a point on it, are at least survivors. They almost always bring notable coping skills to their own growth and healing. And the concept of recovery has various definitions, but for our purposes, it is important to note that the central goal of recovery is much broader than reducing symptoms or returning to some other often dimly remembered prior level of daily functioning. Recovery involves a complex interaction of individual strengths, their vulnerabilities, and the supports and resources available to them. It may mean getting back to one's life. It always means going forward with one's life. It means living a life of purpose and meaning, coping with adversity, finding significant relationships and meaningful social roles. What people say about spirituality and their recovery provides important clues about how faith and spirituality can be uniquely helpful. So let's turn, at last, some of you are probably saying, to what we know about the place of spirituality and recovery from these intense and often marginalizing experiences. The first thing, or just maybe the second thing we can learn from the research literature on this, is that spiritual beliefs, practices, and commitments of people in recovery are really quite similar to the rest of the population in the United States. In fact, mental health problems, substance abuse, and trauma in our country are very common. One recent survey, for instance, indicated that nearly 90% of us report at least one traumatic event in our lifetimes, and people on the whole report nearly 5 traumatic events over the course of their lives. So the similarities between people in recovery and the, quote, rest of us, unquote, is an illusion, because we are them and they are us, we are each other, with due apologies to all the grammarians out there in the audience. The second finding, though, is a bit more complicated. Individuals coping with major life stressors may, in fact, turn to religious or spiritual coping to deal specifically with those concerns. For example, we conducted a study with women trauma survivors with co-occurring mental health and substance use issues. We found that their overall levels of religious coping were significantly higher than those of women in the general population. This finding is consistent with a large body of literature that suggests that people frequently look to religious or spiritual resources to deal with tough problems in their lives. In another survey, about 2/3 of the people with severe mental health problems reported using religious ways of coping with their difficulties. And very importantly, about half of them said that they turned even more intensively to religion or spirituality when their symptoms got worse. So that as problems got worse, their coping with religion and spirituality was enhanced as well. Virtually all of those people said that religion and spirituality had been helpful to them in dealing with their symptoms and difficulties. So it seems clear that in dealing with life's struggles, people in recovery turn to religious sources of support. The third point comes back to where we started this morning, and to Jay's question. For many people in recovery, spirituality is not just one among many resources they may draw on. It is the primary, the major, the most important, the most central part of their recovery journey. A while back, we surveyed women in Washington, D.C. who were part of the Women in Violence Project, and we asked them what, from a considerable list of options, had been most helpful to them in their recovery. The single highest rated set of activities was, not surprisingly, to those in this room at least, spiritual or religious activities that people did on their own. Listening to religious music, reading inspirational material, praying, meditating. If you've ever been on the metro in D.C., you can see the number of people sitting reading religious material, inspirational material, spiritually based material. The third highest rated source of support were religious activities that involved other people, going to faith community meetings or worship services, singing in a choir, participating in spiritually based groups. Right between these two, in second place in this list, was going to a mental health professional. Now, it may be that in this world, being number 2 makes you try harder, but I'm not sure that was the impact it had when I presented these results to a group of mental health professionals who were a bit put off that they had come in second on this list. I don't know if they were more concerned because they were finishing second to things consumers did on their own, or whether they were more put off because they came in second to spirituality. Or maybe it was just a classic double whammy. But seriously, for many of the participants in this survey, the interpersonal world had become dangerous. It was full of rejection and hurt and frequent violence. The idea of finding ways to feel stronger by yourself, on your own terms, in your own way, at your own pace, in places under your control, and drawing on your own understanding of the sacred made a great deal of sense to those of us listening to their stories. Finally, the The most frequently and consistently noted finding in the research literature is that many aspects of religion and spirituality are positively associated with well-being, emotionally, interpersonally, and physically. What we can say with some significant certainty is that the very large majority of studies that have examined links between spirituality and religion on one side and mental health on the other have found that those people who engage in some specific spiritual practice, or who attend services of a faith community, or who declare strong religious conviction, or who simply see themselves as spiritual or religious individuals, also report that they have higher life satisfaction, less depression, less anxiety, and or better overall physical health. So you can see why some people in this field reduce this claim to saying simply that religion is something that's pretty good for you. Okay. If we buy, at least for now, that on the whole, for most people, most of the time, religion is good for you, then the question quickly becomes how? How might religion have this positive impact? A colleague of mine and I were attending a conference at the National Institutes of Health several years ago, and a recurring theme came up that cut across a number of presentations on physical and mental well-being. We started to call it the calm mind. It is pretty much what it sounds like. A sense of peacefulness and serenity that can be quite profound. Andrew Newberg's research has demonstrated. He's written a new book called How God Changes Your Brain, which is actually ought to be rewritten as How You Can Change Your Brain by focusing on God, but that wouldn't have sold nearly as well probably. There are solid neurobiological reasons for many of the emotional and physical benefits that seem to attend a wide range of meditation, prayer, and other contemplative activities. These findings certainly fit with reports from people with serious mental health problems that prayer is one of the foremost ways they deal positively with their symptoms. In trauma recovery groups, we've developed a community connection. For instance, we regularly end each session with a deep breathing exercise or a guided imagery technique. I was so pleased that Stephen Buchholz was doing that here with us this morning because it is so frequently experienced as grounding and centering for those of us who are on edge. Whether we're talking about a vortex of energy in Sedona, Arizona, or someone who's praying in front of a stupa in Sedona, or a labyrinth that's painted on the floor of the Connecticut Mental Health Center in New Haven, Connecticut, or whether God grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. This prayer is ubiquitous. It's so ubiquitous, in fact, that we often forget that it's a prayer. It appears not only on rings and necklaces and coins. If you want to get a great picture of the multiplicity of images that go with this prayer, just Google the Serenity Prayer and Google the images rather than the websites that are associated with it. And there's this one very graphic image of a guy who's had this prayer tattooed on his torso from top to bottom. Now, meditation is a kind of religious or spiritual coping skill. It is an action one can take, a practice that can be cultivated, it can be strengthening. But what I want to highlight under the second heading are the sorts of beliefs or self-statements that can help individuals deal more effectively with distress. Ken Pargman's work in this area is very compelling. His positive religious coping scale involves such items as things like, I think about how my life is part of a larger spiritual force, I work together with God as partners, I look to God for strength, support, and guidance in dealing with my problems. These kinds of beliefs and efforts to come to terms with life stressors have consistently been identified with lower levels of depression and anxiety, and in our surveys, lower levels of post-traumatic stress symptoms. Reminders of God's love for us need to be common. This is a very large reminder, as is this one from College Park, Maryland. We've talked today a bit about how spirituality and religion may strengthen a sense of personal identity. It is an especially powerful antidote to the stigma and marginalization that is still so often a part of mental health issues. If one thinks of oneself as a child of God, or even as a key part of the universe or a valued member of the human race, it is certainly likely to be more validating than to identify with reductionistic psychiatric diagnostic labels. A woman at Community Connections who had thought of herself for years as quote-unquote a chronic depressive got involved in a church community where she got a new label, a minister. She became a pastor whose primary charge was relating to her peers in the mental health community. That reality is very powerful indeed. Whether it's built around a young man whose life is built around the praying hands of Jesus, or a young man who's on a Buddha path, or the footprints poster that we see in so many places that reminds us of the importance of our place in the scheme of things. Similarly, because of the power of stigma, the force of marginalization, or the understandable withdrawal from an abusive world, social support is so often important as a factor connecting religion and spirituality to well-being. There's a woman at Community Connections who had been on the streets for probably 15 years. She had been working as a prostitute, she had been drug addicted, she had been depressed and homeless. When she got connected with services again, she also got connected with a faith community. And I remember talking with her about her experiences going there and how frightened she was when she walked into the door because she thought she was going to be rejected, she was going to be sent back out. But in this African American community, the man who was the pastor came to talk to her, held out his hand, greeted her warmly, and the entire community embraced her as if she were coming back from a long-lost journey. She came back, she said, "I never thought I could be with people again." For her, it was not just that she couldn't be with faith people, religious people, spiritual people, but that community meant people as a whole. For her, being as part of that community meant being a person again. And for many of us who remember after 9/11 the importance of social support, or who know about the Muslim Ramadan services and the friends and neighbors who are invited to it, who know about Catholicism in East Asian countries. Finally, for many people, the most important way in which spirituality contributes positively to sustained recovery is through helping them develop a real sense of purpose, meaning, and hope. If the future seems closed off and individuals are feeling demoralized, there are few resources more powerful than the spiritual to assist in opening that future back up. I was thinking of this yesterday morning when I was listening to the joyful voices who were so alive, so vital, so passionate, so committed, that their voices were truly representations of the Spirit in their lives. But whether we feel called to let justice roll down like waters, as Martin Luther King talked about, whether we talk about the energy that goes with a prayer wheel, or whether we can engage in services that offer us at least what Starbucks is supposed to offer. I was thinking of this the other day. I went to Starbucks. I got a survey to fill out. I went online to fill it out because they said I could win $100 if I hit the jackpot. I didn't win the prize, but it was an interesting survey nonetheless, and it had a lot of interesting questions. It said like, well, how was your beverage prepared? Was it prepared the way you like it? I said, fine. Yes, it was just fine. Thank you. Did anyone greet you by name? I said, well, no, not really. I didn't want to really be greeted by name at a Starbucks because I'm not that addicted to the caffeine. And then came, after a whole series of questions, the final question was, and was your visit to Starbucks today uplifting? At which point I said, well, the caffeine was kind of nice, but uplifting would be overstating probably what I got out of it. On the other hand, being uplifted is something that people should expect from their mental health services. They should expect to be uplifted. They should expect to be inspired. They should expect to go out of their places feeling more empowered, more positive, more directed toward their own futures than they were when they went into the place. Now, I'm not going to spend as much time on these kinds of issues because we all know that they're real also. But I do want to mention them because it's important when we're being honest about spirituality and religion in relation to recovery that we acknowledge that for many people, spirituality and religion have been stumbling blocks. They've undermined recovery, and unless we face that reality, we're also avoiding something that's very real to many consumers as well. For instance, the calm mind has a dilemma, and its counterpart is the fearful mind. Newberg talks about the fact that if you're focusing in your meditation practice on a God of love and peace and serenity, your mind, and quite literally your brain, will become calmer. On the other hand, if you're focusing on an angry, wrathful, punishing, fear-inducing God, your mind will become more fearful. And so it's not only that religion and spirituality are inherently good, it's what kind of religion and spirituality we're talking about. Similarly, there are examples of negative religious coping from Ken Pargament's work that are related in contrast to the positive findings that go with people who think about working together with God as partners, or who think about their life as a part of a larger spiritual force, the sort of positive religious coping beliefs. There are negative religious coping beliefs. The people who wonder whether God has abandoned them in response to the difficulties in their lives, who feel punished by God for their sins or their lack of spirituality, or people who try to make sense of their situation and decide what to do without relying at all on God. All of these negative religious coping mechanisms have been shown to be related to poorer outcomes in terms of mental health symptoms and other problems in life. Third, the empowered self has its counterpart in a devalued self. One of the first women I ever worked with in a pastoral counseling center came to me because she was confused. Her husband had just beaten her. She had just been visited by deacons from her church who encouraged her to be more obedient and submissive to her husband. Oh God, indeed. The sense of her own devaluing and demoralization in that circumstance was understandable, and is certainly a part of some things that religion can do. We know that in religious contexts that are supposed to be safe spaces, people have been abused and violated. We know that these realities are often perpetuated by some of the beliefs in religious communities. So we have to understand that and take it seriously as well. Inclusion and exclusion is another dilemma in recovery. Just as the woman felt that she could be with people again after going to her church, other people have felt that they couldn't be with people because they had been rejected by a church. Churches have, and synagogues and mosques, and all religious communities have the capacity to devalue people when they exclude them because they don't look right, they don't smell right, they don't talk right, they don't dress right, they don't have the right sexual orientation. All of those things that are so superficial and so important for a few religious organizations can be very important in understanding the ways in which spirituality and religion might work against recovery. Finally, demoralization can feel irreversible, especially if it's coupled with damnation over something that is not likely to change. So it's important to recognize the power of the despair that can be induced by many religious organizations as well. I'm going to skip through some of these last slides. Luckily, I have a workshop this afternoon that people are welcome to come to. We're going to talk more about some of the specific ways in which these lessons can be adopted in mental health services. Assessment, for instance, is a very important way in which we can start to adopt some of the lessons we've learned here. For instance, just asking someone, is spirituality or religion something that's important to you? Then really listening to the response. If so, how does it work in relation to your recovery? Is it something that's helpful to you? Is it something that's unhelpful? And then, is it something that we should take account of in providing services for you? 3 simple questions that can serve as a basic spiritual assessment guide. And then if it's something that somebody wants to incorporate into their recovery planning, the question is, how? Is it a problem? Is it a resource? Is it a goal? And finally, making referrals and leading spiritually focused groups. In Community Connections, we've developed some spiritual groups, and I want to talk very briefly about one as we wrap up here this morning. We developed a spirituality and trauma recovery group as part of the Women Co-occurring Disorders and Violence study, which was SAMHSA funded. It has 11 sessions. It was divided into 3 parts. Bread for the Journey, which includes sessions on identifying spiritual gifts and spiritual coping strategies. Facing the Struggle, which includes sessions on anger, fear, guilt and shame, and loneliness. Healing Hope and Vision, which includes sessions on letting go and forgiveness, hope, and the continuing spiritual practice into the future. We conducted a study that was actually conducted by Sharon Boland, who's now at the University of the University of Louisville. And it studied the effectiveness of this group. The women who were in the group were 55 and older, had trauma survivor histories, had some sort of spiritual distress, and either PTSD, depression, or anxiety. What she found was that in every one of these areas, in depression, anxiety, post-traumatic stress symptoms, spiritual well-being, and spiritual distress, all the differences that were found after the group favored the group over the women who were randomly assigned to a waitlist control condition. This is the sort of study that is necessary in demonstrating the value of spiritual and religious interventions in the lives of people who have mental health issues. And one woman's response, I think, sort of captures the reality when she said, "I think just the sheer fact of sharing our experiences with each other is the most important thing. I can listen to each of you, and it's obvious to me that you shouldn't feel guilty or ashamed, and then it's obvious to me that I shouldn't feel that way either." One of my colleagues always reminds me that no matter how long I talk, people aren't going to remember 3 things anyway, so I always put 3 things on the summary slide. But what I want to really close with is a story of which Parker Palmer tells about Alfred North Whitehead, who was a famous philosopher and theologian and scientist of the cosmos. Whitehead had just finished one of his famously erudite and abstruse lectures when a young man walked up to him and said, "Professor Whitehead, that was very interesting what you had to say about the universe, but it's important for you to know something. That universe of which you speak sits on the back of a turtle." Whitehead looked at him and he said, "Well, that's interesting." And he said, "But if that's true," Whitehead asked, he said, "what's that turtle sit on the back of?" And the young man said, "Well, that turtle sits on the back of another turtle." And Whitehead looked at him and was getting more and more puzzled, and he said, "And what does that turtle sit on the back of?" And the young man looked at him and said, "Now, Professor Whitehead, you're being dense. It's turtles all the way down." For people in mental health and people in faith communities, it's really loving care all the way down. All the way down. And it's the all the way down I want to leave you with this morning.